Hello, my name is Karen Dickinson and I'm excited to share our work with you today. The general public are important stakeholders in general surgery training. In fact, none of us would be able to train as surgeons without them. Despite this, we really know little about their understanding and perceptions of resident involvement in their surgical care, particularly when it comes to autonomy and supervision. Public events may also have eroded patient trust in the training system and include the tragic Libby Zion case. These observations and the importance of this topic were the impetus for our study. Our results from a population of 2005 respondents with demographics representative of the US public demonstrate important misconceptions and beliefs with regards to general surgery training within the US. We found that the US public have limited understanding of resident participation in surgical care and do not universally accept trainee involvement. Examples of our specific findings include that most respondents would like to be informed face-to-face of resident participation in their care, and they would be most comfortable with a PGY5 resident being involved in their care. Despite these observations, 1/3 of respondents felt that if a resident was involved in their care, they would be more likely to have a complication. 7% of all respondents would never allow a resident to be involved in their care. Further, only 1/5 of respondents felt that a supervision-only SWISH level was appropriate for a PGY5 resident. On multivariable analysis, factors associated with participants who would never allow a resident to perform any portion of the surgery included female gender, Black race, Hispanic ethnicity, and those with no health insurance. Participants who are less than 50 years old, of male gender, working in healthcare, of Black race, of Hispanic ethnicity, or insured were more likely to believe that resident involvement increases complications. To conclude, we have identified important public perceptions regarding surgical resident autonomy and supervision and suggest that we as a surgical community need to develop and institute patient educational efforts. Our ultimate goal should be to engage all of our diverse patient population, who are arguably the most important stakeholders in the general surgery training process. Thank you.